Venetoclax plus azacitidine is now the standard of care for patients who are older or unfit to receive intensive chemotherapy and are newly diagnosed with AML. But an ongoing question has persisted with respect to what would happen if you took a patient who achieved a remission in this way to a stem cell transplant, because being unfit for intensive chemotherapy does not mean a person is unfit for a transplant. And last year at ASH, Keith Pratz presented some very nice data on 30 patients who had gone to transplant after venetoclax plus azacitidine. The results were very encouraging. We looked at our single institution data and compared the patients that we felt were suitable candidates for an allogeneic transplant in first remission after venetoclax plus azacitidine, and compared those who actually went to a transplant to those who, for a variety of reasons, did not go to transplant. And we saw a very clear benefit with respect to survival for the venetoclax patients who achieved a remission, were suitable candidates for transplant, and actually went to transplant. And I think that this data is very important to communicate to the community at large that this is a viable strategy for some patients, that poor fitness for intensive chemotherapy does not equal a non-candidate for a stem cell transplant, and that in fact, when it's possible to do this, this can have real benefit. So we hope to be able to present more mature data as time goes on, but for right now, I would say very encouraging results for this treatment strategy.